I used to believe that the most painful thing is to lose your job. But no, the most painful thing is when they keep you working. Just remove your dignity from the contract. When you're still here, but you're gone. His brand new suit shone in the light like the packaging of an expensive gadget. Behind him was the pale green wall of the meeting room, still smelling of paint. It had recently been updated, apparently along with the idea of efficiency. "Thank you for coming in, Elisia," he said, and quickly glanced at his tablet. I saw my name there, in big letters, as if I were a guest in this office, although this used to be my workplace. I nodded, just formally, because what else is there to say? "We are reviewing the internal structure and—" He paused, almost gratefully. "We believe it's time to update the terms of cooperation." Renewal. Such a polite word. Like liberation in powdered form. Like optimization for people who no longer go through the motions of Excel. "We offer a new role. Less administrative workload, more flexibility. You will be able to share your experience with young professionals. This is valuable, and we are very grateful for everything you have done." I listened to his voice like background noise, because the light bulbs in my head had already started to turn off, one by one. "As for compensation," he continued, "it will be 30% less than before, temporarily, until new performance evaluation standards are approved. We have not yet introduced them, but we are working on it." I wanted to ask how exactly they were going to measure effectiveness in relationships, in the memory of the names of patients' children, in remembering who cried when and why, even before it was recorded in the card. But I was silent, because I knew that this was not a dialogue. This is an act of transfer of authority, from me to the system. A system that did not care that I started this clinic with 3 rooms and a notebook on a spring. That notebook still contained the phone numbers of people who do not use messengers or email. That notebook contained birth dates, prescriptions from grandmothers who were afraid of even nurses, and doctors' schedules, which were always different from those on the website. I knew all this, not because I was paid, but because I was a part of this place. And now they call me a mentor. But mentoring is when you are respected, not when you are left as a nice photo on the wall. "We believe that you will be comfortable in the new format," he concluded, and he smiled, as if he had given me an opportunity. I looked at his smile and saw only one thing: a calculation. A calculation. A budget was written out. I was evaluated, calculated, and reshaped to fit their plan. I smiled too. It was easy, without subtext, without a promise. But it was not consent. It was the very moment when I stopped being silent. I just hadn't said anything out loud yet. I remember that first day when Dr. Horley and I were looking for a place to put the second chair in the treatment room. I was still wearing sneakers and printing charts at the local pharmacy. We had no automatic registration, no electronic queue, just a checklist and me. I was the logistics, and the contact, and a reassuring smile at the door. What is now called a patient interaction system was my voice on the phone back then, and process coordination was when I was simultaneously making tea for the mother of a patient with diabetes and manually updating medical records. Because we installed the program ourselves, with instructions translated via Google Translate, this place grew out of our inexperience and out of my patience. Then everything went faster. Contractors, financing, new doctors. But while everyone was celebrating the opening of the clinic's 3rd wing, I continued to carry the same black notebook with the numbers of patients who always forgot to come in short notes. Doesn't like injections, afraid of men's voices, doesn't eat after 10 a.m. I was not an office manager. I was something that was invisible in the office, the nervous system, not a heroine. I was just something that kept the body in working order, which did not yet realize how much it was depending on me. And then the new owners came. Not immediately, no. At first, they came as strategic investors, beautiful presentations, models of a new model of balanced workload of doctors, more indicators, less personal, fewer nuances, more tables. They introduced a quality management system, beautiful words that meant automation. At the first stage, I even helped, because I thought, maybe it's really worth moving forward, because technology is not bad, as long as they are not used to replace people, But soon I saw something else. They were not interested in how we worked. They were interested in where we spent our time and how to reduce this time. I could see their looks when I sat down next to a patient and calmly explained to her why her insurance did not cover a new procedure. For me, it was humanity. For them, it was waste of time. This is inefficient. It should be in the questionnaire. But the questionnaire won't tell you why a woman after chemotherapy suddenly starts crying at the reception. The questionnaire doesn't know that yesterday was her late husband's birthday. I knew, because I asked. And I remembered. They stopped listening to me, but they didn't stop using me. Get Elisia on the line. She knows how it used to be. Elisia, make sure the letters to the patients go out. Elisia, call these people. They don't respond to reminders. They thought I was just an executor, someone who should be grateful that he hasn't been removed yet. But they overlooked one thing. All the connections, human, real, everyday, remained in my head and in my notebook. I did not organize a boycott. I did not pretend to be sick. I didn't write angry letters in response. I just shifted a little bit. Not immediately. First, I stopped reminding me that Mr. Rosen, who never warns me, was coming over on Friday at 10 o'clock. Then I didn't mention that his daughter had asthma. No, I didn't mean any harm. I just stopped correcting them, for the first time in 18 years. But it was interesting to watch how quickly everyday life becomes unpredictable when the usual disappears. Suddenly, it turned out that an appointment with an ophthalmologist was confused with an appointment with a gynecologist. That regular patients confused the dates, that the system didn't even have the phone numbers of those who actually left their contacts 15 years ago. "Who's this?" asked Candy, the new coordinator, holding a folder with a latent allergy sticker in her hands, frightened. "This is Mrs. Little," I answered calmly. "She's been coming for checkups after chemotherapy for 3 years. She's afraid of new faces, but you'll be fine." She didn't, and Mrs. Little never came back. And you know, when you work somewhere for a long time, you notice not what sounds, but what disappears. For example, laughter, or the smell of coffee at 8:10 when Dr. Sawyer and I were the first to open the front door. "We need more efficiency," one of the new partners once said at a morning meeting, holding a tablet with numbers in his hands. And I was sitting next to him, holding a pen and notebook. And I thought, I wonder if they even realize that efficiency is not only the number of visits per day. It's when a patient comes back and brings his sister, and then his mom, because he feels at ease. I was silent. I didn't argue anymore, but I started writing down, for myself, in my head, in notes, in an old paper diary, which they considered an anachronism, but it contained the story of everyone who had come since 2006. One day, I saw how the young COO decided to hold an open house, an open day, without an appointment, no limit on the number of people. It was just everyone is welcome. I looked at it as a real-time comedy. At 9:45, the first 12 patients arrived. At 10:20, there were already 38 in the waiting room, and at 11:15, they started quarreling. "I've been waiting for an hour and a half." A woman with a baby was indignant. "Who are you anyway?" Another woman attacked me. I smiled, but not as before, with a desire to reassure, but with the same inner distance that allows you not to take someone else's incompetence on yourself. Then Jason, the new manager, came over. "Why did it happen like this?" he asked, his voice low. "You left no room for real patients," I answered. "And there are no records, and the administrators are new. I only coordinate the incoming calls." "But you knew there would be a crowd, right?" "Of course I did, but I'm not in charge. You decided so." And in that moment, I saw that he understood. Not everything, but enough to feel that he was no longer in control of something that had previously been based not on instructions, but on intuition. A silent war is when you no longer remind them where the key is, not because you are evil, but because once upon a time, everyone knew where it was, and everyone cared, and asked. And now they don't ask, but they point. I saw how memory disappears, not from servers, not from patient records, but from people's behavior. Someone used to notice when Miss Donovan became anxious before she even opened her mouth. Now they would ask her, "What is your insurance account number?" I saw how the human was being erased, and I decided that I would not save it. Not now. Not when I am asked to reduce the scope of responsibility. So I backed off. Gradually, silently. I did not run after the missing files. I didn't fill in the holes in the schedule. I didn't put out fires that I had prevented earlier. I left them. I let them burn. No, I didn't stop coming. I just came later. Not at 6:45 as usual, but at 8:05 as it was stipulated in the contract. I stopped bringing the first aid kit with me because someone forgot to update the supplies in the children's office again. I stopped baking lemon muffins for the junior staff because we don't encourage home-cooked food on the premises. And do you know what happened? In the first week, the results of 3 tests disappeared because they forgot to attach them to the new program. On Monday, the doctors were mixed up twice in the schedule because I used to check it, but now it's automated. And most symbolically, the new COO organized an open house without an appointment. He simply decided that live contact with potential patients was a current trend. I knew how it would end, but I kept silent, and now it's Saturday, 10 o'clock. There's a crowd in the lobby, women with children, older people. Everyone is invited, but no one is registered, because simplicity is our new positioning. I was sitting in my office. I was drinking coffee. And for the first time in many weeks, I smiled honestly, but not with triumph, but with regret. Because this chaos is not my revenge. It is the result of indifference. I was warned that wisdom comes with experience. But no one said that with wisdom comes the temptation to save no one else. On the same day, I started writing. Not in Google Docs, not in Excel, in a notebook, a real notebook. It contained everything. Which patients are afraid of white coats? Who cries after vaccination? Who has a bad hearing, but is proud of not wearing a device? It was not a database. It was a trust card. And one day, in the evening, Kate came up to me. A new nurse, quiet, with big eyes. And she said, "Miss Whitman, Mrs. Talbot wants to know where you are. She says you were calmer." I smiled. Then I handed her my notebook, opened a page, and showed her. "She has a grandson, Michael, who comes every Monday. He has asthma, so you don't want to spray disinfectant in the room before they come in." Kate nodded. She looked at me like I was a cross between a library and a temple. "Are you really not here anymore?" I thought. And I answered honestly, "I am here. Just not to everyone. Only to those who remember why we are here." After that chaotic open house, the clinic became quiet, but not calmly. It was that tense silence, like after a siren has sounded, but you don't know which way to run. The new partners temporarily stopped smiling. The same director who had recently called me a very valuable asset with experience now avoided making eye contact in the corridors. They didn't say anything, but I could feel that I was now uncomfortable. Not because I was violating anything, but because I was not saving them. And this, as it turned out, was the most dangerous thing. But I did not disappear. I just wasn't theirs anymore. I became my own. For the nurses who were afraid to ask, but did. For the patients who still remembered my name, and for myself. I started collecting data, but not the data they counted in tables, but the real ones. How the woman at the reception became irritable after they changed the schedule. How 3-year-old Josh started crying every time he was called a patient because his mom had once said that they were people who are sick. How a new doctor from New Jersey couldn't smile, and the kids were afraid of him even when he was kind. I knew what information was, and I knew that I now had something they didn't, the living tissue of the system. They had budgets. I had trust. At that time, people came to me more and more often to ask me questions. And I answered, but not in a commanding tone, not at a meeting, just in between. I silently handed over notes that I had previously thrown on my refrigerator. "Mrs. Fletcher asks for mint tea, not green tea, because it makes her dizzy. Do not give the children in the room 4 blue balloons. One of them is afraid of color." I was not in the system, but I was already the system. And then something happened that I will remember all my life. Clara, one of the youngest nurses, came up to me and said, "Would you look at this boy? He doesn't say anything, but it looks like something is wrong." I looked at him. I saw it. She sat down in front of me. I asked him not, "Where does it hurt?" but, "What are you afraid of?" He whispered, "That my mom won't come anymore." He was 5 years old. His mom left him with his grandmother for a few days, but no one explained that it was temporary, and they put him in a ward, put an intravenous drip, and started procedures. Their whole new system did not include empathy. It was not in their process. I took the child by the hand. I took him to the hall. I gave him a notebook and said, "Do you want me to write your name here? This is a list of those who are not alone." He nodded, and he smiled. I wrote it down. Max T, 5 years old, loves dinosaurs. He is afraid of loneliness. Asking is not being afraid. Later, others saw that entry, and they started adding their own, without instructions, without an order, just because it worked. And I realized I'm not creating resistance. I was creating an alternative. While they were setting up integrations, I was building trust. And you know what else? For the first time in a long time, I was breathing freely. Because I was no longer playing by someone else's rules. I was creating my own. It all started with a letter without a signature, just a name in the sender field. But it was enough. Hannah Baker. Not just an acquaintance, not just a professional. This is the same Hannah who once taught me how to lead a team in a crisis not through strength, but through clarity. We hadn't spoken for a long time, but I still remembered her drinking vanilla coffee even in July, and how she had once called my work the architecture of trust at a seminar. "Elisia, I heard about your notebook. It sounds like something more than just empathy. We are having an online meeting about human infrastructure in healthcare. No reports, no abbreviations, just what works." I read this paragraph 3 times. I sat in silence in the kitchen. It was still dark. The dawn was just breaking through the curtains. I was holding a cup of coffee in my hands. It was cold, and my head was throbbing. "I heard about your notebook." How? How? Why? I didn't create anything new. I just started writing things down. When I stopped speaking out loud, I started speaking on paper. For myself. For the nurse who didn't have time. For the patient who was not listened to. For memory. Because when everything started to fall apart, someone had to hold the thread. And here she was, extending an invitation to me. I didn't answer for a long time. It seemed that if I said yes, I would come out of the invisible hiding place I had chosen, where you are not under a microscope, where you are not asked questions. But I did. "I'll join you. Thank you, Hannah." A week later, I was sitting in front of the camera at an online rally. All the windows were the same. Squares with faces. Someone from the hospice. Someone from a veterans clinic. Someone from a private practice in Michigan. And me, with the same coffee and the same notebook with 13 names, not just Max's. It's my turn. I don't have a presentation, and I didn't create a system. I just started writing down what is lost between efficiency and optimization. Glances, the pauses, hands trembling before signing. The question that is never asked, but is always in the air. Do you still see me as a person? I spoke slowly, without pathos, without plans for development, and the silence after my words was the longest of the entire call. Then, one participant, the head of a women's clinic in Kansas, leaned closer to the screen and said, "Everything is breaking down for us, because we measure everything but humanity, and your system is essentially memory, and we have forgotten how to work with it." This struck me. It struck me to the heart. For years, I thought that my silence was a weakness, but it turned out to be an archive. And this archive, if opened, can preserve not only the hospital, but also us. After the broadcast, 3 people wrote to me. One wanted a sample notebook. Another sent me a postcard with the words, "You gave me back my faith." And the third was from a company that trains staff in medical institutions. He asked me to meet him. I didn't know what would happen. But for the first time in a long time, I realized that my silence was no longer a defense. It is a vector, and that I am no longer a shadow of the old clinic. I am something new. It has no name yet, but no longer voiceless. It was a Wednesday. I came to the office earlier than usual. I was still a little bit in the grip of the Zoom conversation I had with my colleagues from Illinois. They wrote later, "Can I have your template? We'd like to try it." I sent it. No signature, no logo, just a PDF. But it was enough to start the chain. The next day, I received a message. It was the association's internal newsletter. In the section Initiatives from Below, there was a mention. The practice of keeping informal observation notebooks, an example from the Southern Clinic in Maple Grove. Source, discussion with Administrator EM. No surname. But everyone who needed to know understood. The same day, Mark Shiner contacted me. He had never contacted me directly before, only through administrators, usually in other people's words. "Can I talk to you for a minute, Elisia?" he said when I got off the elevator. His voice was soft, cautious, the kind of tone you use not to talk, but to control. "Of course," I answered, calmly, no tension. He invited me to his office, a glass room without a single document on the table, only an iPad, and a plastic cup with the clinic's logo on it. "I heard that you participated in a discussion online. Did you?" I nodded. No further details. "And it was related to methods of communication with patients?" "Not exactly. I was talking about a situation where silence saves the day, and the practice of the notebook." "The notebook?" He said it as if I had brought an old notebook to a high-tech center. There were personal notes there that proved useful to other clinics. Pause. "Elisia, you know that a clinic is not just a place of treatment. It is a brand, and everything related to our practice must be coordinated, not because we are afraid of you, but because these are risks. Interaction with associations is also part of our image, and if someone from the staff, even with the best of intentions, brings something into the public domain without warning—" "I didn't bring up any protocols or policies," I interrupted calmly, "just personal experience." He smiled a little, not sincerely. "It is this experience that causes the greatest resonance, because experience is already an influence." He paused. "Just let us know next time. Let us know. We will support you, but within the processes." I was silent for a long time. "The thing is, Mark," I finally said, "I don't subordinate my experience to processes, because then it is no longer mine. It becomes yours, and I don't allow that anymore." He didn't say anything. He just nodded and tapped his fingers lightly on the table. I walked out. I didn't look back. In the evening, I finished writing a new page in my notebook. I titled it, "When Experience Becomes Dangerous." When the system no longer needs you, it doesn't hit you. It disappears. This is what happened to me. The morning after the conversation with Mark, my logins didn't work. First, to the internal mail. Then, to the visit planner. Then my badge disappeared, without warning, no official letter, just nothing. And like a fool, I drink coffee in the car in front of the entrance, look at the door, and for the first time I don't understand whether to go in. Eventually, Sandra from HR called me back. "Miss Morgan, this is a temporary solution, until all the details are clarified. Your status is inactive. We ask that you refrain from accessing work systems, and preferably from communicating with patients, just for a while." "For the time being?" I asked calmly, although my mind was throbbing with, "They just fired me." Gently, through the back door. "To the internal audit," she added in a nothing personal tone. "It's all formal, just a review of activities that weren't authorized by policy." Activities. That's what they called my speech, my notebook, my dozens of evenings when I wrote down the processes from reception to callback. When I was building trust because nothing else worked. The first days of nothing were the hardest. I would wake up at 6. I would get ready. And only then did I realize that I had nowhere to go. I would open my laptop and catch myself reaching for the block tabs. I still had tasks running through my head. Who had a deadline? Who needed to reschedule a visit? But I was no longer on the lists, not even among the copies in the emails. I tried cooking, cleaning. I even tried to read. But everything sounded like a background while my thoughts revolved around one thing. Is this it? Is this how my story in medicine will end? After 18 years? And it was at this moment, when my inner monologue had already turned into a fog, that I received a message from Hannah. "Do you have time for coffee? I have an idea, and I know you're the right person for it." Kana used to be a coordinator of a program for elderly patients. Smart, honest, a little harsh, but with an incredible flair. We haven't seen each other for a long time, but that phrase, it touched me. We met the next morning. The coffee shop was half empty. Instead of greeting me, Hannah immediately opened her laptop. A floor plan, a scheme of interaction, and a brief summary. I'm starting a new practice, a small one, but with principles. No overpayments, no optimizations. We will have freedom, but we need a backbone. Could you lead it? Lead, not implement, not adapt. Lead. You know what works. And most importantly, you know what doesn't work anymore. I was silent. For the first time in a week, there was no noise in my head. Only a thought. This is not salvation. This is a chance. After the meeting, I stood by the car for a long time. No one called me back to work. No one called me to explain, to apologize, to solve it in a good way. And for the first time, I didn't want to be called. I sat down at my desk. I pulled out my notebook, and I started writing not about them, but about my own, about what the clinic could be like. Not a new clinic, not an alternative, just the right one. I came without expectations. I just came to see Hannah, to feel if there was something real there. But as soon as I opened the door to that new space, she was not the one who greeted me. I was greeted by the smell of fresh paint, the silence of an understaffed office, and a wall covered with notes. Decongesting the reception area, flexible consultation hours. Patient assistant is not just an administrator. They hadn't opened yet, but it was already a lively place. No pathos, no expensive glass tables, no fixed protocols, just a place where people were thought of. This is our future discussion room, Hannah said, as she led me into a small room. Discussion, because we will not wage war with patients. We will listen. She was different, not the one I remembered from the early meetings at the hospital, where everything was measured by efficiency and Excel spreadsheets. There was no gloss in her eyes, but there was something steady, confident, human. We are launching the pilot next week, unofficially. The first patients are our friends, someone who wants to support us. But if they stay, it means we are doing something right. I didn't say anything. I just sat down and looked at the window. The city behind the glass was breathing, indifferent to my inactive status. And it was a relief. In the evening, I met the team. They were young, but not green. One of them, Seth, was telling me about his previous job, how the questionnaire templates changed every week, but no one changed the questions that really mattered. We want to do it differently here, he said. I read about your trust notebook. If you really wrote it, we already have a compass. I almost laughed, not with joy, but with surprise. My notebook, my personal notebook, which I had never planned to show in public, now sounded like a methodology. And then there was the first day of the pilot. Hannah opened the door in person. I was standing on the side, in the corner. And when the first woman came in, I recognized her. She used to bring cookies after consultations at the old clinic. Back then, we didn't have time to talk for more than 10 minutes. "Do you still remember me?" she asked with a smile. "Of course," I replied. "And do you remember when I used to drink coffee without sugar?" She laughed, and it was a laugh that started something more than a conversation. It was a sign that we had a chance. The next day, 2 more people came. One of them was a patient from the previous clinic. He came quietly, without looking back. And then he said, "It's not the same there. I came here because I heard you were here." And then I realized, the system can remove you from the schedule, from the mail, from the database, but not from people's memories. And if memory is a space where something lives, then I am still alive. It's the 2nd month. We still don't have a sign, just a piece of paper with the words Aurelia on the transparent door. But people already know. They whisper the address to each other as if it were not a clinic, but a secret room where you are not weighed in minutes. Aurelia is not my name or Hannah's name. It was our joint choice. The name is from Latin, light, feminine, without ambitious pathos, just a name that sounds like a breath of air. We start every morning without meetings. No one measures efficiency in numbers, but I see that the rooms are not empty. Each specialist has their own desk, their own voice, and their own patients. We are not afraid of the word empathy. It is not a weakness, but a method. Sometimes I sit down on a bench in the corridor where people are waiting and just listen to them talk to each other. Here they don't ask if you aren't problematic. Here they ask if you're having a hard time. Here, doctors remember your name, and not just your name. They don't ask why you didn't answer the letter. They ask how you are, and sometimes they just don't say anything, but it is a calm silence, without anxiety. The old clinic, meanwhile, changes schedules, announces tenders, posts news on Instagram. But I don't read it anymore. Not out of principle. I'm just not interested. What they call optimization has turned into coldness in the eyes of patients. I don't think about revenge. It has no nutritional value. It gives energy for the day, but not for life. And today is the day I will remember. A woman in a blue coat came to us. She hesitated a little at the door, like those who are not sure whether they have the right to be taken care of. I went out to meet her. "Good afternoon," I said. "Are you here to see us?" She looked up, and I recognized her. She was on the list of the same clinic. She was sitting in line for evaluation, silently, with a folder of certificates in her hands. She never came to me. She was sent to someone else. "I heard you. Discovered something new," she said quietly. "It's not something," I replied. She smiled, and she sat down to fill out a questionnaire, on a simple sheet, without a logo, without QR codes. Just name, reason for contact, what you expect. I returned to my office. And do you know what I felt? Not pride, not victory. I felt silence. But for the first time, not as emptiness, but as fullness. It was the silence from which a brand is born, not from a scandal, but from memory, and out of trust.